Musculoskeletal and Trauma Radiology Paper 1. 1A young patient with short limbs. Lumbar and thoracic spine posterior scalloping. Which chondroplasia is he most likely to have? Achondroplasia. 2 joint pain. A specimen stained positive with Congo red. Which is the most likely diagnosis? Amyloid arthropathy. 3. Which of the following involves avascular necrosis of the vertebral body in patients aged 2 to 15 years? With an intravertebral vacuum cleft sign? Cavcomal disease. 4. Woman complains. Left knee pain. Radiograph chondrocalcinosis. Seen by endocrinologist. What further underlying finding is likely? Hyperparathyroidism. 5. A neonate bile-stained vomiting 12 hours after birth. The plain radiograph demonstrates a double bubble for Down syndrome. What bony feature would support this diagnosis? Hypotelorism. 6 of 1 million people in a region _100 have ankylosing spondylitis. And on average 4 new cases are diagnosed each year. What is the incidence of ankylosing spondylitis in this population? Options are cases per million or cases per million per year as appropriate. 4. 7. A bone scan is performed for the 9 of shin splints in a young athlete who complains of lower limb pain on running. Which best describes most likely finding in this diagnosis? Linear symmetrical cortical uptake seen most avidly along the posterior aspects of the tibiae. 8. Male had CXR as he was short of breath after falling from his bicycle. Area of fibrous dysplasia was noted. Which type of fibrous dysplasia is most common? Monostotic. 9. An 11-year-old girl with hip pain and an X-ray of her pelvis was taken. A lucent lesion with an area of periosteel reaction was visible. The periosteel reaction had a hair-on-end configuration. What is the likely nature of any underlying lesion? Likely aggressive processes. 10. A 25-year-old man with neurofibromatosis type 1 presents with back pain. What is the most common skeletal abnormality? Scoliosis. 11. A 46-year-old man with hemophilia A has a history of a number of bleeds into the joints of his lower limbs. What feature would be expected on imaging? A squared patella. 12. A 7-year-old child with Marfan syndrome is noted to have an abnormality on a skull X-ray. What is the most likely finding? Dolichocephaly, scaphocephaly. 13. A 27-year-old patient with poorly developed finger and toenails presented following a fall onto his knee. An X-ray demonstrated absence of the patella. What further feature would be likely? Bilateral posterior iliac horns. 14. You are asked for advice by a primary care physician of an 18-month-old child who recently had a series of radiographs of their leg following a fall. No fracture was visible, but there is a 1 cm lesion that has been reported as a non-ossifying fibroma. What advice would you convey to the child's parents? No need for specific treatment, spontaneous resolution is likely. 15. An 80-year-old man presented with right hip pain following a fall was assessed initially with plain radiographs of his hip and pelvis and then a bone scan. What feature would be suggestive of Paget's disease? Osseous expansion. 16. A 37-year-old man presented as an emergency after falling off his motorbike. Investigations revealed multiple fractures including bilateral femoral fractures and a skull fracture. His bones were noted to be globally abnormal with sclerosis and there was a bone within a bone appearance of several of the vertebrae. Alternating sclerotic and lucent bands were visible in his iliac wings and the base of his skull was noted to be particularly dense. What is the most likely diagnosis? Osteopetrosis. 17. A 37-year-old female with a long history of right knee pain is eventually diagnosed with pigmented villonodular synovitis, PVNS. What are the most likely findings on imaging? Joint effusion. 18. A 46-year-old coal miner with recently diagnosed rheumatoid arthritis was investigated for respiratory symptoms and found to have multiple rapidly developing lung nodules throughout the lungs with the upper and peripheral predominance. What complication is likely to have developed? Kaplan syndrome. 19. A 45-year-old woman with a history of a systemic disease presented with hand pain. What feature would favor a diagnosis of sarcoidosis over scleroderma? Reticulated trabecular pattern. 20. A 56-year-old female patient with stiffness and pain was referred for a radiograph of both hands. What features would favor a diagnosis of psoriatic arthritis over one of rheumatoid arthritis? Periosteel reaction. 21. A 36-year-old man presented with leg pain and an abnormality was noted on the initial radiograph. He then had a bone scan, which appeared normal with no evidence of the abnormality. What would be a possible explanation for this? Acute fracture. 22. A 16-year-old athlete presented with a history of locking of his knee following injury. His plain radiograph demonstrates a small opacity within the joint space. What is the most likely diagnosis? Intra-articular loose body. 23. A 73-year-old man sustained a ureteric injury during a road traffic accident and is now hemodynamically unstable. What is the most appropriate radiological investigation in the acute setting? One-shot IVU following intravenous contrast medium administration. 24. A series of radiographs of a patient's spine shows hypoplasia of the pedicles, transverse processes, and spinous processes. There is also a sharply angled thoracic spine and dural ectasia in the lower lumbar spine with dumbbell-shaped enlargement of a number of neural foramina. What is DX? Neurofibromatosis, 1. 25. A 20-year-old man jumped 30 feet from a building onto concrete and landed on his feet. He was assessed in the emergency department and complained only of severe pain in his feel. He remained hemodynamically stable, and after a full assessment it is clear that his only injuries are to his feet. What injury is he most likely to have sustained? Comminuted calcaneal fractures. 26. A 46-year-old woman is brought into the emergency room after a road traffic accident. She was the driver and had a high-speed collision with a parked van. She responds to pain and is hemodynamically stable. There are no obvious bony or visceral injuries on either primary or secondary survey. She has had an urgent CT head, which revealed no abnormality, and her C-spine is clear. As the on-call radiologist, you are asked to review her chest X-ray. Studies available for comparison. What should the subsequent radiological management be? Contrast-enhanced CT chest. 27. An elderly lady fell onto her back and experienced severe back and buttock pain. Pelvic. Radiographs revealed marked osteopenia but no definite fracture. A bone scan was then performed, which showed an H-shaped pattern of increased uptake. Which bone is likely to be involved? Sacrum. 28. A woman with poorly controlled diabetes mellitus fell down the stairs feet first. She did not experience much pain but found it difficult to walk after the fall and visited the emergency department, where a doctor noticed that her ankle joint appeared abnormal with a large hematoma on the medial aspect of her foot. Neurological examination demonstrated bilateral sensory impairment in a stocking distribution. What injury is she most likely to have sustained? Lisfranc fracture dislocation. 29. A 44-year-old man had an accident in which he was thrown from a motorcycle. He landed on his left foot, which folded beneath him. On the day of the injury, his foot was examined and standard AP and lateral radiographs revealed no fracture. The foot was placed in slight plantar flexion and immobilized with a cast. After 3 days, the patient was re-evaluated and his foot remained edematous. Ecchymosis was noted laterally and he could not weight bear. What injury is he most likely to have sustained? Torn ligament between the second metatarsal and medial cuneiform. 30. A 56-year-old plumber complained of long-standing bilateral pain anterior to his knees. There was no history of trauma, although he reports spending 2 hours a day kneeling. AR lateral and skyline radiographs of both knees showed soft tissue swelling anterior to the patella but no bony abnormality. What is the most appropriate further management? No further imaging, rest and occupational modification alone are adequate. 31. A 26-year-old woman suffered an assault in which she sustained a blow to the right side of her chin. She was unable to close her mouth fully and her incisors were chipped. An orthopantomograph, OPG, examination revealed a mandibular fracture. At what anatomical site is the fracture most likely? Mandibular condyle. 32. A 94-year-old lady was found on the floor in her nursing home. On arrival to the emergency department, the attending doctor noticed the short, externally rotated right graphs of the right hip were requested. These show a minimally displaced fracture just below the right femoral neck and just above the greater and lesser trochanters. What is the treatment of choice? Uncemented hemiarthroplasty. 33. A football goalkeeper to the ground while making a save and experienced immediate pain in his wrist. The action replay shows forced hyperextension in ulnar deviation. Radiographs reveal no abnormality on the AP projection, but a subtle fracture on the lateral view. What bone is most likely to have been injured? Triquetra. 34. A skier fell on his outstretched hand with his hand caught in his ski pole and sustained an abduction injury of his thumb. His thumb was painful and swollen and he noticed that it felt unstable. He consulted a doctor in the resort who arranged radiographs of his hand and wrist. What is the most likely diagnosis? Rupture of ulnar collateral ligament. 35. A 47-year-old woman sustained a significant flexion injury to the cervical spine as a result of a high-velocity road traffic accident. Her spine was immobilized and she was taken to the local trauma center for assessment. A lateral cervical spine radiograph revealed 50% anterolisthesis of C4 on C5 and malalignment of the apophyseal joints. There was no suggestion of a rotational component to the injury. What type of injury is this? Bilateral facet dislocation.
ऐसा आसान easy है ठीक है रटा होने से बस तो कुछ स्केलेटल स्पाइन है और शॉर्ट लिम्स है तो ये achondroplasia ठीक है common red पॉजिटिव है तो amyloid and all the other ठीक है intravertebral vacuum cleft valve communal venereal disease ठीक है आसान है फिर double bubble sign Down syndrome होता है उसमें increased space between orbits यानी hypercellular decreased space between orbits तो ये hypothalamus आगे फिर जो ये है stress fracture है तो linear symmetrical body uptake तो ये monostotic curvatures ज़्यादा common होता है here end pattern to like regressive process है NF1 में scoliosis नजर आता है hemophilia में squared patella डोरी को सिर्फ पहले या स्कैब से पहले थोड़ा एक ही चीज़ है bone within a bone appearance seen osteoporosis है PVNS के अंदर joint fusion होता है sarcoidosis में reticulated trabecular pattern होती है ठीक है अगर हम डायनामिक अनस्टेबल पेशेंट हो ना तो और सस्पेक्टेड विट्रिक इंजरी है तो अनस्टेबल है तो वन शॉट आईवी फोनिक इंटरवेंस कंट्रास्ट ट्रीटमेंट ठीक है अगर स्टेबल पेशेंट है तो सीटी करेंगे ठीक है सीटी केवी भी करेंगे दूसरे एमसीक्यू में पीछे था ये जो है फुल ट्रैक एक्शन है पॉइंट मियोस्टीन है ना हम क्या करेंगे उसके लिए स्पॉन्टेनियस सीडी करेंगे और अगर ऑप्शन में ट्रांसफॉर्मेबिलिटी को काम है तो इसको प्रेफरेंस देंगे ये कहीं दूसरा एमसीक्यू होगा ठीक है स्टॉकिंग सेंसिटिव इम्पेयरमेंट होती है ना ये स्पाइन फ्रैक्चर में होता है स्पाइन फ्रैक्चर सिचुएशन में और फिर इसमें क्या होता है कि हेमाटोमा एंड मिडिल एस्पेक्ट ऑफ फुट हेमाटोमा एंड लैटरल एस्पेक्ट ऑफ फुट होगा तो टॉर्निकमेंट जगह मेटाटास एंड मीडियम फॉर्म है ठीक है मैंडल में मोस्ट कॉमन फैक्टर है कंडाइल यहाँ ट्राइकोटल फ्रैक्चर हुआ है ठीक है फोर्थ हाफ फ्रैक्चर है अंडर डेविएशन ठीक है फिर जो है अगर कॉल प्लेयर हो तो उसके अंदर हैमर फ्रैक्चर होता है ये स्कीयर आउटस्ट्रेच हैंड कॉट इन स्की पुल तो ये रप्चर ऑफ अंडर कोलैटरल लिगामेंट ठीक है 50% एंटीरोलिस्थेसिस मतलब बायलैटरल पैसेज डिसलोकेशन 50% कम हो तो यूनिलैटरल पैसेज डिसलोकेशन है ठीक है